Now, this is a what I call the cascade of chronic pain, and this is a way of thinking of how these problems proceed. And clearly, an injury can occur, and this can be a physical injury, either mild to severe, or it can be a repetitive stress injury, or it can be a physiologic injury, or asking a muscle or muscle group to do some work that it cannot handle in terms of necessary strength. Now, depending on what that injury is, will almost always cause some myofascial pain. It may be severe enough to cause something that will need surgery, such as a ruptured disc, such as a ruptured internal organ, or a fractured bone, etc. But always remember that even though the patient is being treated for their major problem with surgery, they have also developed myofascial pain, so that the surgery may not be curative in terms of their pain. They may still have pain, but it's not from the problem that resulted in the surgery, it's from the original injury. The surgery itself, either by retractors pulling on muscles, or by just the fact that a muscle is pulled to the side for a period of time, may in fact result in new trigger points developing in patients. We can have ligament tears, which may or may not be significant enough to require surgery for repair, but may in fact be present for many years and can certainly lead to the development of acute myofascial pain as well as chronic myofascial pain. Surgery often results, or always results, I should say, in scar tissue forming not only on the skin but deep into the tissues where the surgical procedure was done. And if this involves nerves, can create significant neuropathic pain. If it doesn't directly involve a nerve, but maybe involves tendons and or muscle itself, can lead to chronic myofascial pain. And clearly the neuropathic pain that develops from the scar tissue can set off chronic myofascial pain, and that can also entrap nerves and set off neuropathic pain. So you can see how all of these are interactive. The initial myofascial pain can then develop into a chronic regional pain syndrome, or an RSD, if it is usually peripheral, and it may involve one or more limbs. On the other hand, in susceptible individuals, it may cause a central sensitization and lead to a systemic condition known as fibromyalgia syndrome. And we'll get into discussing some of this as we go along, so it will make even more sense later on. But this is a convenient way of looking at this. Frequently, the patient may have persistent pain after your treatment, and you should always try to obtain this information before the patient leaves so that you can correct the problem. And the causes of this persistent pain is you didn't get all of the trigger points or the entire trigger point. It may have been a larger area than you treated. You may have treated in the reference zone rather than at the site of the active trigger point. You may have missed the target altogether. If you're using a needle, you could easily have missed the target. If you're using a laser, which basically is a non-penetrating needle, you could easily be at the wrong angle and miss the target. Because remember, a trigger point is three-dimensional in space. It is not two-dimensional. The patient may have fibromyalgia and may just have generalized pain that you won't be able to deal with simply by inactivating a trigger point, or 2 or 3 or 10. Or you may have totally the wrong diagnosis in the patient. maybe they do have a disc, and they felt better after you got rid of one of their trigger points, and then 5 minutes later it came back. That's likely to be a disc problem. The new approach to dealing with these trigger points is the low-level laser, or the so-called cold-level laser, which you obviously are interested in because you are listening to this webinar. It's a non-invasive trigger point injection, basically. There is no pain associated with it, no heat associated with it. The only heat a patient may be aware of is that the head of the instrument will become warm the longer you use the laser and generate the laser beam. The unit itself will develop a little bit of warmth. So basically there is no risk as long as you don't shine it directly in a patient's eyes if they don't have glasses on. As I noted to you before, my experience with the ML830 low power laser is this needs to be adjusted. I've inactivated more than 120,000 individual trigger points over the past 7 years, and only 4 trigger points could not be inactivated. These were due to depth in fatty tissue, in 3 where they had very large buttocks and I needed a very long needle to reach the muscle in which the trigger point was contained. The 4th one was a bodybuilder who had a very thick, dense pectoral muscle that he had injured, and the laser beam just was not strong enough to get through this dense muscle, and I simply injected the trigger point. Occasionally there is a time, depending on the nature of the unit that you're using, of an inability to access a site due to overlying bone or the size of the laser head. This has been largely eliminated by the use of the so-called acupuncture cone that can be attached to the ML830 and has a very small single beam head, and the unit is still very effective with that. The low laser therapy from the ML830 is generated at 830 nanometers, and that is chosen for the greatest penetration. So the nanometers will determine how deep the laser beam will penetrate, and it uses gallium, aluminum, arsenide to generate the laser beam. And the ML830 has 3 30 milliwatt beams, which generate a total power of 90 milliwatts, and this will determine the effectiveness of the beam at the depth to which the wavelength allows the beam to penetrate. It generates 3 joules per 3 square centimeters, delivered every 32 seconds. Then you have to turn the unit on again. The patient will usually not feel anything other than an occasional twitch in the muscle. They certainly do not feel any pain. The effects of each treatment are additive as long as you don't allow more than about 3 weeks, 2 to 3 weeks to pass between treatments. And there are essentially no side effects. One caution is that in a situation in which you have a very acute inflammation where there's a lot of redness indicating a high blood flow, that if you treat with the low power laser at that time, you may exacerbate the inflammation. This is due to an increase in blood flow that occurs because of the effect of the low power laser. Usually what we do in that situation is simply wait for a few days to allow the inflammatory heat to die down and to become a little bit more chronic so that the blood flow isn't that great, and the laser works perfectly fine in that situation. The technique for using the low power laser is to, first of all, remember that the laser travels in a straight line, and it's essentially a non-invasive trigger point injection that is painless. When you feel a taut band on which the trigger point is located at the most tender spot, you do want to move the laser along that long axis of the taut band very slowly and gingerly, just to make sure you've got the entire trigger point. And you don't want to overtreat or undertreat in terms of the amount of time that you use the laser on the trigger point. What we normally do is to go for 3 cycles directly over the trigger point. And then we palpate it again. If it's gone, we stop. If the patient still notices even a small amount of discomfort, then we use 1 more cycle and repeat this, checking again to see if the trigger point has resolved and the pain is gone. And usually, let's put it this way, it's very rare to have to go to 5 cycles. 4 is unusual, 3 is common, and 2 is also not very common. The benefits of therapy is that you get significant pain relief because the laser desensitizes the small nociceptors in the area through which the pain impulses are transmitted, and therefore the patient's pain significantly decreases and in fact goes away. There's also increased blood flow in the microcirculation because of the use of the low power laser. Causes the release of nitric oxide, which is NO. It's 1 nitrogen and 1 oxygen molecule. It is not nitrous oxide, which is a gas. It is nitric oxide, which allows the blood vessels in the microcirculation to dilate and blood flow to increase, which then allows much of the metabolic actions to go back towards the normal oxygenated system and away from the anaerobic situation, which generates lactic acid and a lot of these other alphabet soup of inflammatory compounds that sensitize the nociceptors initially and create the pain. And what these are the 2 main acute ways that the laser stops pain from trigger points. And eventually the laser will promote healing by increasing protein synthesis through increased ATP production in the cells. And this is how the laser will promote growth and how you can treat some of these small venous ulcers or diabetic ulcers with the low power laser. The applications of low power laser works well in arthritis, especially of the small joints. You can't really use it on the hips because of the location of the hip is not only so deep, but it is shielded by much of the area of the pelvis. Myofascial